when you have a buccally impacted canine, this is one side effect that can happen to you. So can you see the gingival margin on the left side of the canine on the left side and the canine on the right side? So we have lost some of the gingival attached gingival tissue, and this could happen because when we try to extrude the tooth, we are in the free gingiva, and sometimes the gingival desmosomal attachment does not move along downwards as we think they would. Yeah. So it is still a good result. Why? Because what I want you to keep your eyes on, can you see this gingival regrowth here, Nisha? So this gingival regrowth, this is not an inflammatory tissue. This is a new attached gingival tissue that I
Oh,
want you to
wow.
look carefully for, because that is going to minimize how the tooth is looking. The way
Okay.
that you are going to preserve this regrowth of attached gingival tissue on the canine is by good oral hygiene
Okay.
plus very mild forces. So don't be tempted. I know that you're always that tempted to do this torquing movements and going to rectangular archwise fast. Please don't. So
Oh,
wait on light forces until you think that when you put the next wire, it is going passively in the canine.
yeah.
And you have to wait as well because you see here that this is a distally tipped canine. It needs some time to mesially tip. Yeah.
Yeah.
The second thing that we are always worried about in buccally impacted canines, and they have done a great job, by the way, because in many instances, when we get the canine down, when we extrude it, we see that we are lacking labial bone. Hmm? And you can see the blanching of the root of the canine here, which means please don't be tempted at any interval now to try to extrude the canine more or attain like a perfect class 1 canine relationship. Because any exclusive force now is going to do labial root torque. Fine? And you don't want that now. So your main aim here is to try to regrow that attached gingiva and
Yeah.
give time for all the periodontium to try to catch up, like getting you new bone on the buccal surface of the canine and gingival tissue. Fine?
Would, would she need a periodontist to see her?
Not now. Wait until
Not.
this. Can you see this red bulgy
Yes.
tissue here?
Yeah. Yeah.
When this transforms to an attached gingiva like the other ones
Mm.
beside,
Yeah.
and we want to do this sort of maybe a graft, although in my opinion it does not work every time. And in
Okay.
many instances, these young people do not notice that much. Hmm?
Okay.
And if you look at the left side, the pretty thing on the left side is that there is still, this is not the whole clinical crown on the left side. This is
Yeah.
just like 3/4 of it. So you still have the tendency to do some gingivectomy in this canine.
Okay. Now,
Fine?
the root is not too much labially talked, right? It's the
In the
of
canine,
the
it
one
is.
three.
No, it
It
is
is.
too much labially torqued, and we need to do much work in order
Uh,
to correct the torque of both the lateral incisor and the central and the canine as well. So lateral incisor has labial crown torque as well. Hmm?
so what? So you told me to flip a bracket, a
Yeah,
canine bracket.
great. Thank you that you have mentioned that. Can you all
Uh,
see that this lateral incisor bracket is being flipped? And that flipped bracket is going to express the torque, a negative torque that's going to move the root of the lateral incisor forward. But this would happen on rectangular archwise, not now. Don't hassle to go on rectangular wise.
yeah.
Keep that wire in for a while. Yeah.
But on the canine, you said to put a flipped bracket as well. That's not going to express labial root talk
No.
on the canine.
Well. Good. So what is the torque expression of the canine?
-7.
-7. Yes, good. But you have to make sure, Nisha, because in the Damon system, there are high torqued brackets on the canine. They are +7. So
Yeah.
have you flipped this bracket or not?
Yes, it is flipped.
It is flipped. All right, so you
Yeah.
have to make sure from Isaac that you
Yeah.
have got the standard torque bracket. Yeah,
Okay.
because the
Okay.
standard torque is -7.
Okay. Yes.
If you flip, and here I'm talking about the Roth.
Yeah.
So if you flip a bracket with -7 to +7, you are in correct position. But if it is originally a +7, it should be placed without flipping. So you need, at the end, you need a plus torque on the canine and a
Yeah.
minus torque on the lateral incisor.
Yeah.
Yeah. And it
Yeah.
doesn't make a difference now because this is a round wire.
Okay.
So it doesn't make any difference for us now.
Okay.
All round wise, there's difficulty to express any torque now. We are
Yeah.
talking about later on. But this is a good job because you haven't done extractions and you have created
Yeah.
space and you have got this canine down. This is just before I guess that you have done one thing, the tunnel technique. We did the tunnel technique in this patient, yeah.
Mm.
And I was talking, I can't recall. Yeah, it was the group of Adnan. I was talking about impacted canines, Adnan, yeah. And I was telling you about the drawbacks of doing a free mechanics. So this is a free mechanics in which you put a force from the canine to the mini screw without a wire. So I was talking to Adnan and his group, telling them that we have three types of biomechanics. One type is free mechanic, the other type is a compound mechanics where you do 2x4 appliances, and the third one is a complex biomechanics where you attach the wire to the old teeth. Yeah. So the free mechanics, it has to be always slow and light forces. Why? Because you will be faced with definitely tipping and unwanted tooth movement that you cannot control for. It is difficult to anchor for this unwanted tooth movement in free mechanics. But anyways, this is one way that free mechanic can do you harm. When the canine gets out the free gingiva, it is always difficult to extrude this canine with attached gingiva. But this case was a difficult one. I remember it now.
We learned about this thing called a power vela. It's a
Parvella,
tube. Yeah. It's a tube with a power arm,
yeah.
which you want to upright a second molar. You can put a wire through the tube and then use the power arm power
And
chain
what
to
wire?
attach.
You use a TMA wire inside. It would
No,
work well if you use a TMA wire. Other than
yeah,
that, stainless steel wires with these gadgets are
yeah,
used to do are used to facilitate the force that you apply on mesially tipped cane
yeah,
molars.
yes,
Yeah.
yeah,
So if you are going to use these gadgets, any gadgets that you are going to use for uprightening, please use TMA wire, a
yeah,
17 by 25, not a stainless steel wire, because you need light forces, and keep these teeth under your observation, because what usually happens during uprightening is you need uprightening with sometimes mesial root torque, not uprightening with distal
yeah,
crown torque. Are you
yeah,
following me?
yeah.
Because if when I do distal crown torque all of the time, I get this crater shape bone resorption at the mesial side of the molar. So always keep light forces, use TMA wires when you do molar uprightening.